a busy bee, also being active as a multinational networker, present in advisory boards and councils. And I have your slideshow, so Margareta, go ahead and just say next when I should move on.
Yeah. Okay. So well, I'm going to talk about the patient perspective and involvement, and it was really before because this is just continuation. So the agenda for my meeting here today is, well, who am I and why am I here? And is the patient involvement valuable in personalized medicine? And how can you or I be included in the projects for a better result? And also recommendations for patient involvement and co-creation. And next, please. So I need just to have a short CV on my cancer career, I would say. My second life, really. I have lymphoma, chronic lymphoma since 1994, lymphedema since 1995. And of course, I was really keen to understand what it was all about and my cancer. And I formed an organization for chronic edema. And we were members of the Swedish Network Against Cancer. So we joined them, and I became the chair for that organization in 2018. And between 2018 and I would say around 2020, the Swedish Network Against Cancer really tried to educate, to be educated and to be trained, to be patient advocates. So we could actually meet both the clinicians, professionals, researchers, politicians, and other stakeholders. And that led to that we became members of the Government Patient Council in Sweden and in many expert groups for digital infrastructure and cancer strategy. And also we were sitting in many expert committees in the National Board of Social Affairs and Health. And just now we are investigating and scrutinizing the EU Beating Cancer Plan in Sweden. How has it been implemented? And we've done that for 2 years, more or less, and we will continue doing it. Next, please. And my engagement, I would say, have led to that we have become partners in a lot of organizations, and you can see some of them here. All Can Sweden, for example. Then we are also in All Can EU, EUPATI. We are also in Sweden, but also in EU. We are very much collaborating with Biobank Sweden and their research unit in Europe, BBMRI ERIC. And we are members of Cancer Patients Europe. And we are now involved in AMBER, which is an EU project for digital rehabilitation in the Baltic countries and in the south of Sweden. And ECPDC, which is European Cancer Patients Digital Center. And they have now the name EUCIP, Cancer Information Portal. And that's a very, it's a very intense work, I would say, with a lot of meetings to get this going in all Europe, to have a digital center for all nations in Europe, which would form actually the patient situations and the patient experiences and knowledge together with the healthcare systems. It's a bit of a challenge, I would say, but we will go there. And then we're also members of OECI, which is the Organization of European Cancer Institutes, and I am a member of the working group for patients there. So this has actually done that we are involved in many organizations, and we see that we are actually better together. If we are all stakeholders working together, we can actually reach goals that we couldn't if the patient perspective was not there. So please, next slide. So the question was, is a patient involvement valuable in personal medicine? Yes, it is. we have seen in our investigations on what is there are challenges for many of the clinicians and for the healthcare systems to include the patient in a professional and in a genuine way. And we feel sometimes that we are ticked off in organizations instead of using us to have us contribute to better healthcare and better research and better projects. And this will also lead to an improvement of the patient's quality of life and next of kin if we are in every project from the very start, I would say. And the patient co-creation leads them to better research. And we wish and hope, and we see also many times now today, that we have become a partner and a resource in healthcare. But healthcare doesn't really sometimes understand us. We need to learn and teach and talk and educate in health literacy. But we feel that the researchers, clinicians, and project stakeholders, they need patient literacy also. We need to understand each other. And unless we do that, we will not have a good collaboration. So next, please. The basis then for our work with collaboration and patient involvement is actually a standard EU standard. Sweden adopted a standard for minimum requirements for person-centered care by the Gothenburg Center for Person-Centered Care, and that is in Gothenburg University. And that was also adopted by EU. It's very basic, but it is the basis for collaboration and for working together. And I will only say that the last one there, that the service users need to recognize and develop their strength and abilities, because we can then live an independent, fulfilling life. And we see that many of the professionals that we work with, it takes a year or half a year until we really can shake hands and we understand each other. And after that, you do have trust, you have confidence, and you have an open transparency for whatever you do. And we feel that is very important. So then the next slide, please. So this led to that we, together with both researchers and other patient advocates, started investigating how do people collaborate, how do patients collaborate in the world. And we could actually find that we could have a sustainable co-creation with patients for better research in healthcare. That was a result, and I will come back to that. And that this true collaboration between us, it gave us hands-on guidelines and 6 very clear recommendations and an introduction checklist how to actually involve the patients and work together. So next slide, please. That is a report, but I will have a QR code later that you can use. So the report then is based on an extensive review of scientific literature and reports. And we were actually reading 8,000 scientific articles and 4 Swedish. The other ones were in English, but there were 4 Swedish articles on patient involvement. And we also used grey literature. And we had a series of interviews with patient and next of kin and patient advocates. And we had case studies and workshops. And we actually used almost 3 years until we actually could publish this report that you saw the front page of. So next, please. So the literature we actually reviewed could show the following positive results. And we could actually see that the advantage of collaboration in research, and this goes also for projects, of course, and innovation, that there are much more relevant study objectives and more relevant study designs and outcome measures. And also it led to more and better funding opportunities if you included the patients there. And this really led to increased trust and efficiency, quality, and patient safety. And that was really something that we didn't understand it in the beginning, but when we actually investigated all this, we could actually see that increased patient safety, and it improved health economics as well. So next one, please. We were funded by Biobank Sweden together with the Karolinska Institutet to make this report. And later on, we were funded by Vinnova to spread the report and have trainings and workshops and meetings with clinicians, researchers, politicians, innovators, to actually make them understand the benefit of including patients and the benefit of how to do it. So we ended up with 6 very clear recommendations based on these scientific findings and documented experiences from patients and professionals together. And I intend to go through them, the 6 recommendations. So we skip the titles here and we go to the next one. So the first recommendation is that you will need to have clear aim goals and evaluation criteria formulated together. And we can see now many times we have been asked to come in, join us in a project, but the people ask us doing it the day before they will apply. And then today we say, sorry, we cannot do that. We need to understand what you want and the aims for this, a goal for the project. And we want to contribute, not to be there as somebody sitting aside. So it's very important, I think, that you who apply for a project, that you actually include a patient partner from the very beginning before you apply for it, if you can. And we do have very different aims and goals, so you have to discuss them openly. And you may need to compromise. So you should be very clear about the goals you agree upon, very clear. And it's also very important to evaluate your success, but also if you fail, because that is also a sort of a success. You can go on and do something else later. And you need to do this for your own record and to inspire other people. And we see it as when we started telling people about this the day before they applied for a project for Vinnova, we can see now that people come to us much earlier on, and they want really to inform us about what is a project about, how can we together succeed in this project, so we can actually take our hearts into the project and to engage ourselves very much in the project. So the next slide, please. And this is also a recommendation. You need to confront power imbalances because some partners will always have more power. In case of the patients, you need to think about patient representatives come from an organization. Many times they still have this disease or complications after treatment. So this needs to be addressed, that you need to understand that patient representatives may be fragile, may not do everything you wish them to do because they may be ill suddenly. In my board, we are 10 members, and until 2024, from 2018 to 2024, 20% of my board died every year. And this affects not only the person who actually has died, but it affects you and your friendship and the efficient, fantastic people who are working. And all all the patient advocates, they work voluntarily. They have no remuneration many times. And they do this because they feel that it should be better for the persons to come after them, and kids and relatives. And this has to be in mind when you actually do the projects and when you perform the project as well. So every party needs to know also what they can achieve and what not. And they need to plan for resources and engagement. And this is all to avoid disappointment and mistrust. The next one, please. And due to the imbalances in power and resources, all partners cannot be equally involved in all processes. But then it's really important that you have an open and clear communication, because otherwise you will have a lot of misunderstandings in your working groups. And you need to be open to actually build trust and confidence. And that you have this open dialogue and inclusion of multiple perspectives. And this will also help you to find new solutions in the project. So next one, please. We have put this number 4 as a very important recommendation, because patient representatives work freely. They are usually not paid for anything still in Sweden. I don't know how it is in many other countries, but we have what we say, you have to have a good pension if you are a patient representative, so you can actually perform your work. It is almost always voluntary. In Sweden, we have now some kind of adapted document from universities and authorities that patient representatives are paid for travel to the meeting and for accommodation for the meeting, and sometimes a small remuneration for actually the time they spent on doing the work. And this, of course, makes that it is difficult to find young patients who are working because they cannot afford to leave their job to work voluntarily, for example, 2 days to go somewhere. And that is a large problem for patient representatives in Sweden today. So to reach this representative, it is difficult. But in a project, you have to start with mapping of relevant groups, and also you have to take informed decisions about who to include. And when I say who, I would actually say to who, because if you have one ordinary member in the project, you will also need to have one second person who can jump in when the ordinary member cannot be there. And this happens, okay, for us, it happens rather often, I would say. So we are always 2 people in every project. And you have to co-create strategies together with target groups for successful inclusion. So, and next one, please. So many times in projects, you have short projects, and then you will not lead, you will not develop this trust and confidence unless you actually have the patients in the project before you actually start working with the project. Because many times you have to build long-term structures for collaboration. And you are talking about 5 years, aren't you, at this project, the PerMed? So that is it 5 years, Casper and Karin? I don't hear you. But I would say that a long collaboration, a long-term structure is much better for the outcome of the project. Because if you only have 1 year, it's very difficult. Then you will have to know the patient representative before you start the project, I think. So you also have to grow trust and confidence in your organization, but by showing that collaboration is a priority. And we have seen that this is really one of the most important items. You actually have to show your company, your organization, yes, collaboration with patient advocate is a priority, because then the organization may believe in you also and in the patient. So include more partners than you expect to need. I already mentioned that. And I still don't know. If I read the papers really carefully, I know how many years the projects are, but I can't remember. But that's okay.
Yep.
So next slide,
Yes.
please.
Now my mic is on. I didn't want to interrupt you, but the partnership is 10 years, so we have quite some time. But then each individual project that gets funded in the course, they are 3 years, so they have a different challenge. But it's still 3 years.
Yes.
Go on.
Okay, that's good. And number 6 on our last recommendation is that share your experiences all the way, good and bad, and spread the word and contribute to this culture change. So this is a true collaboration. And save the resources by learning from each other's successes and mistakes. And also increase public interest in this collaboration. And we can see that some projects, they work, I don't know, behind curtains somewhere. You don't really know what they're doing. But if you really want to succeed with this project, you need to open up and to show what you're doing, and to have everybody in there to have this increase this public interest in the collaboration. It's very important. So the next slide, please. So the co-creation with project stakeholders is that you should collaborate with all stakeholders to learn, also you, not only the patients, but you will learn, and you must inform and spread patient experience and knowledge around, because we need to have more patient advocates, many more patients involved in all healthcare systems, I would say, innovation system, because we have not been requested before. And now suddenly it is like an explosion, and we are much too few. So what we have done now, we are in a project, Swedish National Platform Study Focus, and we requested that all patients who were going to sit in the patient board, they needed to go through Europati education training, and also the training for GPCC have also training in healthcare and in research, because we need to understand the system, and we need to understand research, and we need to understand projects. And that is really difficult for us when we are in the actual applying system. You need to be very open with the patients so that they also understand what is the goal, how do you do this, what does PerMed really do with you, and all the whole chain of processes. So include the patient advocates in all decision making from the very start, and monitor, follow up, and evaluate these transparently, and include patient advocates in project groups. The next one, and I think it's the last one, isn't it? And we feel that the person-centered care is very much involved in this patient involvement, and so it leads to partnership. But meet the needs of the patients and focus on what really matters to patients. This will be a success story for you if you do. And promote shared decision-making and person-centered care. See that patients improve health literacy, and that you improve patient literacy. And use patient-reported outcome measures to empower patients so that they feel that I can do this if they don't really dare to do things. They need to be empowered among themselves, and that you also do it for them. And use digital health tools, health data platforms. And promote patient cares to access patient organizations and support groups. Many times, persons and clinicians do not really inform patients or patient advocates that there is a patient organization here. Go to them so that you feel some support. Thank you. And this is the QR code to an updated report, which was called SAMKA, and that we actually were funded by Vinnova. So thank you very much for having me here.
Thank you, Margareta. I'm so happy you attended and that we were able